Unplanned care is for situations that arrive unusually. For example, you may have a bee sting, you may have a broken leg, you may have a heart attack. These are all situations that are not planned and that may need care.
What should you do if one of these situations arises?
Well, there are a variety of options that people can use. The one that is most appropriate would be to look after yourself at home, particularly for things like bee stings, coughs and colds, minor cuts and grazes, bumps and viral infections are all easily dealt with at home. If things are more serious than that, then there's a great resource in the local pharmacy. They are located all over the city. They're often open longer than a GP surgery is, and certainly at weekends. And they are a real resource of help and support in minor illnesses.
Where does your GP come into this?
If you have a minor illness or an accident that you can't treat yourself or has persisted for longer than a few days, that's the time to go to see your GP. GPs are well placed in the community, and they know you and they know your medical history. If you need help outside of GP's opening hours, not everybody is aware that if they ring the surgery number, they will be put through to GP out of hours, and they too can then give them the appropriate help and advice.
Isn't there a new number to call for advice?
Yes, there is. We're very fortunate in Salford to have NHS 111 functioning fully. This has replaced the old NHS Direct number here in the city. You can ring it at any time and you'll get advice, or if you ring your GP surgery out of hours, you'll be asked to put the phone down and redial 111, and they are fully equipped to take your history and point you in the right direction for whatever help that you need.
So what is the role of A&E?
A&E is a fantastic resource, and it is primarily for accidents and emergencies, and by that I mean serious accidents, fractures, road traffic accidents, serious falls and injuries, and medical emergencies.
There's been a lot in the press recently about increased attendances at A&E. What can you tell us about that?
This has become a really big problem because people are going to A&E with very minor things. And for instance, people do go to accident and emergency when their false nails are broken, or if they've got paint in their hair. They often attend A&E because they think that they're going to get better treatment than they could get in primary care, and for chronic conditions that's not the case at all.
So do lots of people go to A&E who are not registered with a GP?
They certainly do, and that's part of the problem of the increased attendances. It really is important, if you're living in Salford, that you register with a local GP, so that you can be prepared should you have an unplanned injury or accident.